This is Don and Dan coming to you from The Clinical Trials Guru. Again, that website is www.theclinicaltrialsguru.com. We got a good interview today with a couple ladies. We have Jody Earhart from Midwest Center for Research, and we have another young lady that's accompanying her, Miss Tony Ranella. Did I say those names correctly?
Yes.
And how are you ladies?
Very good. Thanks.
Yes.
Good. Jody, tell us a little bit about your clinic and what your clinic does there.
We do everything from phase 1 to phase 4 clinical research trials with a focus right now on gastrointestinal issues like Crohn's, ulcerative colitis, irritable bowel syndrome, that kind of thing.
Sounds like fun stuff. And Tony, you want to tell us quickly a little bit about yourself?
Stay-at-home mom right now, substitute teacher periodically. Been diagnosed with Crohn's disease back in 1999 and patient of Dr. Taramina for probably 2 decades.
Okay, all right. And just to share with the audience today, you're participating or you've participated in a trial?
I am.
Okay, do you want to share with us what type of trial?
That is the
TSO, it's ova of a worm.
Okay, and how's it going?
Good. It was wonderful. The first part of the trial is over, and I am anxiously waiting for the second part of the trial to begin.
Wow. Now, what prompted you to try a clinical research study instead of just going to the doctor and dealing with the doctors out there on the market?
Well, in the past, visiting Dr. Taramina, I did notice the clinical trials and never was interested in it because I didn't know enough about it. But once Dr. Taramina had talked to Jody and had her call me and explain it a little better, and
Okay.
I came in and talked to Jody and Jen about it, and they answered every single question I needed to know, which is what made me decide to do it.
Now, is Dr. Taramini, if I'm pronouncing that correctly, is he the PI on this study? Is he working with the study in any fashion?
Yes, him
Okay,
and
wonderful.
Dr. McCullough are our PIs for the
Oh,
trial.
beautiful, wonderful. So they're keeping their ears to the ground, because I know one of the issues that a lot of physicians, even when they're involved in the trial, they're not thinking clinical trials when they have someone sitting in front of them that they're providing therapeutic services for. They're usually
And
not, you know.
We did have that problem in the beginning because it's a very hard switch to make when you're used to your standard of care. You know, these are the symptoms you see. This is the medicine you usually go to. These are the procedures. But the more we did and the more patients started talking about it, we would even have patients be in to see the doctor and they would say, well, maybe you should. And they'd be like, wait, what about that clinical trial my friend Bob told me about? And then it just became our whole office does it. Medical records will
Wonderful.
come across the facts and be like, hey, this would be a perfect study person. So
Wonderful.
Now, Jody, just so we get a better understanding of your company, what's the size of your company right now?
well, it's mixed. The research facility is also part of the regular practice. So in the building are about 35 people working, 2 physicians, which are also the investigators, and then a nurse practitioner, which serves as sub-investigator, and then a research nurse.
Okay. So as far as recruitment, because we talk about this all the time for those research clinics watching, we think that sponsors really prefer your kind of sites, you know, the kind that pretty much pull from the patients from the practice. You don't really go outside. I would imagine you don't go outside that often to recruit, or am I wrong?
No, you're right. The majority, I would say 90% of our study patients come from our practice, people that are coming in to see the physicians for a certain reason. We also, though, we go to area health fairs and we introduce our services both clinic-wise and study-wise.
Okay.
And then we also have very active social networking pages. We send out newsletters, and we have kind of a neat little thing for the area. We have a patient education night that our practice puts on 2 times a year. We serve snacks, beverages, we send out invitations, we put up posters at all the pharmacies, and it's just about whatever topic it is. Anybody's welcome to come, even if they've never been a patient. This last one we did was gas, bloating, and diarrhea. We played colon bingo, and our prize was a Quick Trip gas card.
Colon bingo, that's an interesting one.
And the doctors are both there. They answer questions, they give a presentation,
Great.
and they give a question and answer period. And then I talked clinical research, and so we did get new patients and participants from that too.
So public education seems to be the key point.
Yes, yes.
Now, Jody, what is your role there? I don't know if we got into this yet. Are you part of the recruiting or marketing or?
I'm actually the director of the clinical research department.
Oh,
So-
okay.
and then Jenny, our coordinator, one of our coordinators, they do a lot of their own recruitment too. The physicians are, if they have a patient, they'll call down for whichever coordinator it is, and that person will go down. Or if people just email us blindly from the website or from a Facebook or from a health fair, then we divvy them up, send the email to whoever it goes to. So.
Okay. Now, as all of us that are involved in research knows that there's a lot of paperwork involved. How do you guys separate that from the medical clinic itself? Because I've known medical clinics that have tried to get into research. They've never done it before. When they got hit with all the reg paperwork and all the rating sheets and all these things, they just lost it.
And that is, we have a separate, what are our lab area where we keep all of our lab supplies and our refrigerators for drug, for investigational product, is also where we keep all of our regulatory documentation, all of the binders for that. Everything is behind lock and key. And so it's separate from the actual, we don't even keep in the medical records area of the practice, we don't keep any study stuff there. So we keep shadow charts, and we keep everything study related in one spot.
Wow, wonderful. Very well organized.
And Tony, thanks for coming on. We always try to feature study participants on our show. We try to get their perspective. And we've had people who have had good experiences, bad experiences, neutral experiences. We always try to find out, how each individual's experience was so that others can learn. I guess one question I would have for you is, was this your first trial or have you done trials before?
No, this was my first.
This was your first. So what was your idea of clinical trials before you started this study?
Maybe a guinea pig and a little
Guinea
wheel.
Yeah, you see, the guinea pig thing always comes up. People think we make fun of this stuff, but it's true. Like, people really believe that clinical trials are for guinea pigs. So how did you get over that?
Probably through the extensive information that I was given. The more the information that I got, the more questions I had, the more answers I would get. And like I said, Jody and Jen, we sat there for probably 45 minutes, and even the most stupid questions I had, they had a good answer for me. And
Great.
I cannot tell you how comfortable it made me. So that was my ticket in.
Now, what even got you to that point of listening? Because if when people think of guinea pigs, I would imagine you were highly skeptical going into even the opening question of clinical trials. Like, were you approached for a clinical trial, or did you ask about it? How did that whole process kind of pan out?
Jody
called
called me. She called me, and we had maybe a 20-minute conversation, and just Jody and Jen themselves, they were the driving point. Mm-hmm. For somebody to be able to come into the office and have a couple questions answered is one thing, but to have Jody and Jen there 24 hours a day, offering me a telephone number to get any information I want at any time of the day. I've talked to Jody, texting her at 10 o'clock at night, asking about clinical trial and questions that I had regarding the next phase that's coming up. And she was more than happy to be right there with me answering these questions. So if there's anything that made this easy, it was the fact that they're there, and they're there to answer every single question.
Wonderful.
That's good. Now, Tony, if these questions ever get too personal, just let me know. But we try to find out why people join studies. A lot of people join because they're looking for better treatments. Some people join, to kind of help future medicine. Others do it for the money. Others do it just because, they're bored. What was your reason for doing it?
With my Crohn's disease, I have chronic diarrhea, chronic excessive diarrhea. And the medications that I am taking, although they moderately help me, I'm seriously trying to find another way of help other than having to have surgery again.
Okay.
And I've already had one resection done, and my next step would be to have another resection done, but I would really like to try and avoid that. And I was hoping that this would be the route. And with the first phase of this trial going so well, I really think this is going to be my ticket to avoiding surgery again.
Yeah, and then I know a lot of studies, they have an open label phase afterwards. So if you happen to have done well on the medication, you'll get it for like a year or two. Is that an option for this study?
Not yet. This one, that would be more of a phase 3. We
Okay.
haven't worked into that section yet. So
Okay.
Okay, now what phase, I may have, you may have said it, but I missed it, but what phase is this study?
it started as a phase 1, which we did, and now it's in phase 2.
Okay, great.
Yeah, so we always try to find why people join studies. So we thank you, Tony, for helping kind of clarify that. And there's other people out there watching who may be thinking just like you were that why would they want to be a guinea pig? So hopefully your experiences can kind of help people make more informed decisions about clinical trials. Now,
Exactly.
for this study, were you concerned? First of all, is there a placebo? And then were you concerned about that?
Yeah, I was told that there was a placebo, and concern, not really. Hopeful that I didn't get it, yeah.
Yeah.
But no, I really wasn't concerned. I trust Jody and Jen and Dr. T, and I'm glad I did it.
Yeah, and you're hitting on some really good points. I think people need to really listen close to, and that word trust. Trusting the people that you work with makes a big difference too.
And Jody, for these kind of studies, because we do psychiatry studies, so they're a little bit different, but what's an average enrollment for you, like for a study that Tony's in? Is it like 30 people in the trial? Is it 50? Is it 10?
It would be more like 30, 35 for that. We do have trials that are very long-term and they're shorter, like 8 people. And then we have all the way up to trials that take on 50.
Okay.
Okay.
Yeah, well, we thank you guys for coming on. And
Absolutely.
Now, how far along are you? You said you finished the first part of the study?
She is in month 2 of a 6-month trial.
Okay. So far things are going okay, and if you had side effects, you just let the PI know. And
I haven't had any side effects. Everything's been
wonderful.
great.
All right. Well, I wish you much success.
Thank you.
And I like what you guys are doing there, Jody. It's real positive. I like the way you guys give so much support to the people that participate. It makes a big difference. And the way you also, I can just tell the way you two communicate right now, there's a good bond there. And I think that's
Yeah.
extremely important when you're doing what we all do out here.
it's going to help the public perception of clinical trials. We really need more sites like you guys. To be honest, I didn't know anything about you guys before this interview, but we've interviewed sites on here before, and some of them just kind of, they treat their studies like a numbers game. They've got to hit numbers, but it seems like you guys go above and beyond that, with the bingo stuff that you guys do. And we really need more sites like that. And this is Don's favorite topic of patient recruitment.
Yeah.
We need more sites that kind of do things the right way as far as recruitment. And we've heard a lot of bad stories out there, so it's refreshing to hear some good examples here.
Absolutely.
Thank you.
All right. You ladies have anything you want to add?
Tony,
No, I'm good.
I think that's it.
All right, well, this is Don and Dan signing off from The Clinical Trials Guru. Again, that website is www.theclinicaltrialsguru.com, and thank you very much.